Good evening. This video is a little video on learning methods. During this video, we'll discuss a little bit about what mental imaging is, a case study that is for an interprofessional team, a clinical simulation idea, as well as an ethical scenario question, and lastly, we'll end with a um, gaming type learning method. So without any further ado, let's go ahead and get going. So, all right, so mental imaging. So what is it? Mental imaging is the rehearsing of a skill that's in the mind without physically moving. It's pretty much picturing what needs to be done and how to do it. Mental imaging can be used both in the classroom for regular students, as well as patients with stroke. As you can see down at the bottom, I have a reference from, I'm going to really butcher the name, but it's Orgortseva et al. This was a article that was done on using mental imaging through stroke patients. So the type of people that can use mental imaging, this can be done with anybody that is either a visual or a hands-on learner. It just pretty much allows them to kind of visualize what's going on before they do it. So how is mental imaging done? Mental imaging is pretty much exactly what it sounds like. You are picturing what the task is in your mind before doing it. So you'll actually picture what the different steps are. And then the person who is doing the mental imaging will need to be able to kind of picture what something feels like and what it sounds like. So a good example of that would even be just like picturing, okay, you've got a piece, you have your eyes closed, you've got a piece of fruit, and you know that it's a piece of fruit. You can see it, you can feel it, you're smelling it. You just use all your senses and be able to kind of just picture what you want to do. So if it's going to be like you're going to be eating it, you just picture yourself picking it up, smelling it, eating it, biting into it. For like a medical based idea, it can be just like picturing, okay, closing your eyes and walking through each one of the steps. So like as you're doing an IV, you're feeling the arm, you're feeling the needle, and you can feel, you're picturing that you're feeling that the needle's going in where it's got that little bit of a pressure, and then seeing the blood flow back into the needle. So it's just pretty much using imaging before you do your actual skill. All right. So the second part of the assignment was to discuss a case scenario that could be used for a interprofessional team approach case scenario. So this case scenario kind of looks at a 53-year-old male that will present to a facility that is confused and not taking his mood stabilization medications and feeling suicidal. The patient's well known to the unit, so the staff kind of know how he is usually and compared to what's presenting. His meds get restarted, patient's still sleepy all the time, appears to be heavily medicated. He does go through some couple of medication changes, and within a week of that starts reporting increased hallucinations, incontinence of the bladder, and appears to be more confused. So the unit sends him out to the ER. The ER shows that he has bronchitis. He's not coughing much, and while he was there, there was no evidence of a UTI or any abnormal labs. Psych is stating that it's medical, and medical is stating that it's psych. So in this case scenario, the players that are involved can be the nurse, social worker, case manager, doctors, both the psychiatrist and the regular medical provider. Um, so um, this is actually based off of a little bit of a actual patient. So um, then getting any of the data. So we can see that we've gotten some data already that there's different medication changes, there's changes in the behaviors, ER lab reports. So this scenario is one that can be reused and um, should be able to know why we're doing it. So this is a good one for getting multiple different disciplinaries involved. Um, and then evaluating it, um, you can kind of see that it's still something, it's a scenario that can be built upon. And then this case scenario could be revisited and changed as needed. Um, so that looks at the six um, six parts or six stages in the um, Bradshaw et al. 2021 book. So, all right, for the clinical simulation. Um, so the topic that I picked was safe patient handling of behavioral patients. This type of simulation that could be used for this type of simulation would be more of a real life, hands-on, um, more like role play, where you have somebody being the patient and the rest of the group playing different roles, whether it be a nurse, healthcare tech, a social worker, anybody else that would be involved in restraining that patient. Um, so the psychomotor skills that the person would be learning would be how to do hands-on restraint, how to do uh, chair restraint, how to put all the belts and where they go. Excuse me. The cognitive skills would be pretty much using de-escalating techniques. One of the areas that we use at our facility is it's the CBI. It's clinical behavioral intervention. So knowing how to do the different skills. So as an educator, their role would be first possibly to do a little bit of mini demonstration on how to do stuff. Then it would be mainly kind of stepping back, facilitating, watching, letting them do it, figuring out what they're doing wrong. If something's becoming unsafe, stepping in, saying, "Hey, what's going on? What do we need to change here? Something's not right." Lastly, the debriefing. Debriefings always work best. What went well? What didn't go so well? What are things that we need to work on? Was there any injuries? Was there anything that could have been done differently or to make the um, simulation run smoother? And then just redoing it if need be and playing the scenario out a second time. Excuse me. All right. The next part of the assignment was ethics scenario. So designing um, a scenario that could be used as a discussion for a ethic class debate. Well, one thing that I had happen was an end of life treatment. So the scenario type or the statement would be, when should the nurse begin to advocate for a patient when the treatment is futile? and the family and doctor keep pushing for treatment. The scenario kind of looks at a patient that has stage 4 cancer, comes back from every appointment extremely sick. Family keeps pushing the patient for treatment, but the patient wants to stop. The patient has told the nurses, "Hey, I don't want to go on anymore." Family calls the oncologist, and the family keeps getting reassured from that oncologist that he's going to be able to cure that patient. All right. So the last step of it was to design a game. I did go off of one of the suggestions, and I found that there is actually a nice website out there that if you do it once, it's free, but if you try to do it more than once, it costs in order to do a crossword puzzle. So I designed a crossword puzzle that actually uses a little bit of, so pretty much what you would do is you would use this as like a study guide off the reading, and each one of the clues are part of the explanation of the different learning methods. So, so with that, um, I hope that this kind of gave a little bit of information on the couple of different learning methods, looking at some scenarios that can be used, as well as looking at what mental imaging is. Thank you.